I hope I'm audible and visible. Good evening, everyone. I hope my audio and video are okay. Please respond in the chat box if everything is fine. I hope I'm audible and visible. Good evening, everyone. I hope my audio and video are okay. Please respond in the chat box if everything is fine. I hope I'm audible and good evening, everyone. I hope my audio and video are okay. Please respond in the chat box if everything is fine. Okay, so I'll start the session now. Once again, a very good evening to everyone. This is Dr. Mamta Jawa, and the purpose of this session today is to give you a sneak peek into some of the important topics of microbiology which are likely to be asked in the upcoming exams, plus some dil ki baat, in other words, my own viewpoint regarding how to master your mind when it comes to exams. Okay. The purpose of this session today is so guys, first and foremost, थोड़ी पढ़ाई कर लेते हैं. I'll discuss some important questions followed by some important slides. And the very first question of today's session goes like this. An elderly patient with a history of uncontrolled hyperglycemia is hospitalized because of fever, purulent nasal discharge and recurrent epistaxis. Sinus culture produces the microbes shown in the photograph. Non-septate hyphae in histological sections confirm the physician's fear of tissue invasion. From which of the following infectious diseases is the patient suffering from? Disseminated coccidioidomycosis, invasive aspergillosis, pneumocystis pneumonia or rhinocerebral mucormycosis. And this is the picture, all right, which was, this was the morphology of the organism seen when it was cultured. So guys, what do you think we are dealing with in this case? Let us rule out each option. Now, option A says disseminated coccidioidomycosis. Now guys, Coccidioides immitis is a dimorphic fungus and it does not look at all like this. The kind of morphology which this fungus shows in human tissues is in the form of spherules filled with endospores. Okay. Now, second option says invasive aspergillosis. Not at all. As you can see in this picture, basically we can see sporangium. These spherical structures are sporangia, and we can see the non-septate hyphae. All right. Then option C, pneumocystis pneumonia. Now, pneumocystis pneumonia caused by Pneumocystis herovesii. This organism exists in trophozoite and cyst form, and this picture does not fit into the morphological description of this particular organism. All right. So what we are left with, A, B, C are easily ruled out. So we are left with option D, that is rhinocerebral mucormycosis, which fits the bill, keeping in mind the history with which this patient presented. All right. Now guys, rhinocerebral mucormycosis is by far the most dreaded disease caused by a class of fungi known as Zygomycetes or Phycomycetes. Okay, so our answer in this case is rhinocerebral mucormycosis. We could see the non-septate hyphae in this picture and sporangia. Okay, so some important take-home messages regarding this class of fungi. Remember Lord Ram. Zygomycetes or Phycomycetes members can be remembered like this. We have got RAM respectively, which stand for Rhizopus, Absidia and Mucor. Now remember the first and last alphabets in English, A and Z. A should remind you of aseptate, and Z of Zygomycetes should remind you of Zygomycetes. So A and Z, this is the class of fungi which has got aseptate hyphae or non-septate hyphae. And the most common species which is responsible for human disease is Rhizopus errhizus. Okay, guys, in the entire mycology, we have got two important classes of fungi where the members are angio-invasive. Okay, angio means blood vessel, invasive means to invade. And as I already said, rhinocerebral mucormycosis is by far the most dreaded disease. This is an angio-invasive fungus which has got a predilection to invade the blood vessels. Okay, and now in this particular clinical entity, rhinocerebral mucormycosis, the mode of infection is inhalation of the spores of the fungi. Just like God is omnipresent, similarly the members of this class of fungi are also omnipresent. The spores are plentiful in the environment. It's a saprophytic fungus, so the spores could be inhaled, followed by involvement of the paranasal sinuses, and if the immunity is very low, the fungus could reach the brain as well. Now the $1,000,000 question is, who is susceptible to develop such severe disease? Remember two important D's. One is desferrioxamine therapy and the other one is diabetic ketoacidosis. Okay, so DD or demand draft, diabetic ketoacidosis or desferrioxamine therapy. Because this is an iron loving fungus. Okay, it loves to have iron, and that is why these two are important predisposing factors to develop such a severe disease, rhinocerebral mucormycosis. So the blood vessels are going to be invaded, followed by infarction of those tissues which are supposed to get blood through those blood vessels, which will not happen. That is why there's going to be infarction and necrosis. Now this is a picture depicting the hyphae of mucor. As you can see, the hyphae of this class of fungi are broad, irregular sort of, and they are very they are ribbon like. They look like ribbons like this. And a very important thing me as a microbiologist should keep in mind is the fact that when we are suspecting infection by any fungus belonging to the class Zygomycetes, in the lab I should tell my clinician not to vigorously do the tease mounting of the sample which we have received, because vigorous tease mounting is going to break down these hyphae. Then we won't be able to appreciate such nice picture under microscopic under the microscope. So that's very, very important. And this is the picture of Rhizopus in tissues, again depicting the broad ribbon like aseptate hyphae. This is HNE stain. Now the colonies of Zygomycetes have got a typical description referred to as cotton woolly colonies, as you can see in this picture. And specifically as far as Rhizopus is concerned, the colonies look very, very similar to salt and pepper. Hence the colony description is given as salt and pepper like colonies. Okay, so this is an actual picture of a case of rhinocerebral mucormycosis. You can see this necrotic tissue over here. All right, so that's about Zygomycetes. And the other important class of fungi which has got the ability to invade the blood vessels is members of the genus Aspergillus. Okay, so remember these two important classes of fungi. Then moving ahead with the next question. An outbreak of serious pneumococcal pneumonia and sepsis amongst inmates in an overcrowding prison has occurred. Lab analysis determined that one serotype was involved. The prison physician said that the pneumococcal vaccine might have limited the outbreak. Which of the following structures of the pneumococcus is responsible for determining the serotype and is also the immunogen in the vaccine? Now, what do you think? Is it the capsule or the flagellar protein or the O antigen or the peptidoglycan? Now guys, it is very easy to rule out some options if you have basics, if you know the basics of microbiology. Now capsule definitely is an answer, possible answer in this question, but even if you think option A is the right answer, do have patience to see the other options. Now option B says flagella. Now pneumococcus or streptococcus pneumoniae is non-flagellated. It's a non-motile organism, so definitely flagellar protein is not the answer. Now as far as option C, O antigen is concerned, guys, O antigen is the part of lipopolysaccharide or endotoxin, which is an integral structural component of gram-negative organisms and not gram-positive organisms like pneumococcus. So straight away you can rule out B and C. Now option D, peptidoglycan. Peptidoglycan also is not the answer over here, because peptidoglycan structure is the same in all bacteria, with slight differences in gram positive and gram negative organisms. All right, now the culprit in this case is the capsule, because we know the organisms which possess capsule, they are very difficult to be phagocytosed by our phagocytes like neutrophils and macrophages. All right, and there are approximately 95 different types of capsules of pneumococcus which have been discovered till date, and the important serotypes which are incriminated in human diseases, we have used those capsules to create the vaccine against pneumococcus. All right, so the question is asking which structure is responsible for determining the serotype and is the immunogen in the vaccine. The answer is capsule. The answer is capsule. Now, some important facts about pneumococcus. It is a diplococcus, and all cocci are not spherical. This is a classical example. This coccus is lanceolate shaped or flame shaped. All right. Now, flame shaped. Now, this is a very arrogant organism. Aag laga dega. Like some humans, these organisms can be also sadistic. Okay. Aag laga denge is just a memorizing tip for the flame shaped morphology of these bacteria. All right, now so Streptococcus pneumoniae or pneumococcus exists in this morphology. There are two organisms together and encapsulated by a nice capsule. All right, now the risk factors to develop severe disease because of this bacterium are, remember, sadistic, people who have undergone splenectomy, then alcoholics, diabetics, immunoglobulin deficiency, because we know IgG is a very good opsonin. All right, and because the most important virulence factor for pneumococcus is capsule, if IgG is deficient, these organisms cannot be opsonized. So that itself is a very, very important risk factor. Then sinusitis, trauma to head, infection of the ear, and complement deficiency. All right. Okay, so that was about pneumococcus and the class Zygomycetes. Now I want you all to focus on this particular slide and notice what is happening over here. Okay, so we can see a baby, and the baby is being hugged by somebody. Who is this somebody? This red fellow or rod shaped fellow is a rod. All right, and it is motile. You can see I have drawn two legs, and it is motile via peritrichous flagella. Okay, peri means perimeter. Peritrichous flagella is the arrangement of flagella where the flagella are arising from the entire perimeter of the organism. All right. Trichous means hair. Flagella, just like hair, are very slender, thin structures. So who is this fellow who has got so much of love or affinity for this kid? Okay, this organism feels so attached to kids, but it will make them poop. Now in the chat box, could anyone tell me what organism are we talking about over here? Anybody? Otherwise I'll say the answer. Okay guys, it is enteropathogenic E. coli or EPEC. Remember P for pediatric, okay, also known as enteroadherent E. coli. Now guys, in infants and kids up to 2 to 3 years of age, the most common cause of diarrhea is rotavirus actually. Remember, बच्चे रोते रहते हैं, तो rotavirus is the most common cause. But if we talk about the bacterial etiology in this age group, this bacterium is the most common cause actually, EPEC. All right. So enteropathogenic E. coli, it is also known as enteroadherent E. coli. Why it is called as enteroadherent E. coli is because of this reason. Now, this organism has got a predilection or its habit is to attach to the microvilli or the brush border of the enterocytes. And once it does so, it is going to cause flattening out of these microvilli, just like this. Okay, imagine if my fingers, if my palm is the enterocyte and my fingers are representative of microvilli, and this pen is nothing but EPEC. This pen or EPEC is going to attach to these microvilli and flatten them out. Okay, just like when we iron clothes, the iron flattens out the creases. Same way over here, what is happening? There is flattening of microvilli happening. And why has God provided microvilli to enterocytes? The reason is microvilli increase the absorptive surface area. So you only think if the absorptive surface area is being flattened out so much in this case, what will happen? The nutrients are not going to be absorbed, and this flattening is known as effacement of microvilli or the brush border, and the end result is going to be diarrhea. All right, and why only these organisms can cause all this? Because of the presence of an important gene possessed by them, that is LEE, that is locus of enterocyte effacement. So AE lesions or attachment effacement lesions are occurring because of the possession of an important gene by this organism, that is the LE gene. All right, now some important differentiating discs which we use in the microbiology lab. These are the antibiotic discs which help us to differentiate between one organism from the other. Now first and foremost, we have got the novobiocin disc. All right, now this is an important antibiotic disc which will help us differentiate between two important coagulase negative staphylococci species, that is Staphylococcus epidermidis and Staphylococcus saprophyticus. All right, now as you can see in this picture, okay, this pink colored disc is actually a filter paper disc, 6 mm in diameter. N is written over it. It is novobiocin disc, and over here, staph epidermidis is unable to grow in the vicinity around the disc. So what is our conclusion? Epidermidis is sensitive. On the other hand, saprophyticus is fearless. It can go right up to the novobiocin disc. All right, how to remember this? Remember, no stress. All right, no stress. NO should remind you of novobiocin. Then stress, remember, saprophyticus is resistant and epidermidis is sensitive. Then next we have got the viridans streptococci. All right, now these viridans streptococci cause alpha hemolysis on blood agar, and alpha hemolysis is also caused by another very important bacteria, namely pneumococcus or streptococcus pneumoniae. But out of these two organisms, the viridans streptococci and pneumococci, which one is more important pathogen? It is pneumococcus. It's very, very important to differentiate, to find out, to find out the cause behind alpha hemolysis. If we see alpha hemolysis on blood agar plate, whether it is viridans or whether it is pneumococcus. All right, so over here we can see one blood agar plate, and the method to differentiate between these two organisms is the optochin antibiotic disc. Now remember, V are COPS. VR is viridans streptococci. V for viridans, R for resistant, COPS. C for nothing, O for optochin, P for pneumococcus, and S for sensitive. All right, so pneumococcus is sensitive, whereas viridans is resistant. Okay. Now, next important differentiating disc we have, the third one, is the bacitracin disc. All right, remember, BRAS, BRAS. First B is bacitracin. Then the second B stands for group, the B of group B streptococcus or GBI. All right, and all the other beta hemolytic streptococci. Group B streptococci or GBS, also known as Streptococcus agalactiae, and all the other beta hemolytic streptococci, they are resistant to bacitracin, whereas the A1 or the number one pathogen in genus Streptococcus, that is Streptococcus pyogenes, is sensitive to bacitracin. Okay, so group A streptococcus, also known as Streptococcus pyogenes, which also, by the way, is beta hemolytic, can be differentiated from other beta hemolytic streptococci by this simple differentiating disc test, where group A streptococcus, that is Streptococcus pyogenes, is going to be going to be sensitive to bacitracin. All right, now what you can see over here, who is this fellow? Now this is a creepy larva and its intention is not at all good. Now this larva wants to get into the skin of this character, this person who is walking bare feet. What am I referring to? I want you all to remember the names of the nematodes which are transmitted by skin penetration. Remember, these are highly sticky worms. They stick onto the skin. Remember H and S. H stands for hookworms. Hookworms hook onto the skin literally. All right. In hookworms we have got Ankylostoma duodenale, that is the old world hookworm, and Necator americanus, or the new world hookworm. All right, both cause iron deficiency anemia. Then S stands for Strongyloids stercoralis. Now these are the examples of nematodes which cause infection by skin penetration. So the mode of infection is skin penetration, and what is the infective form? It is the larva. Okay, it is the larva. So guys, that was about some academic discussion which I wanted to do today, and the tagline of the flyer for today's session was kept as master your mind. I think for a long time I have been wanting to address all the students informally regarding certain aspects which the students often forget, but on a personal level I can tell you certain tips have helped me personally as a person, and I hope these tips are going to help you in your upcoming exams and in also in life in general. Okay, so I would want to share this important technique with all of you, how to master your mind, because even Bhagavad Gita says a person who is able to master his or her mind can master anything, can overcome any hurdle. Okay, and exam is just this upcoming exam. I know it's a very, very important exam. I'm not undermining its importance by saying it is just an exam. It's a very important exam, but trust you me, if you learn to control your mind in these remaining 7 days, you can turn the tables around and the results will be in your favor, even though you might be feeling कि अभी ये रहता है, वो रहता है, ये नहीं पढ़ा, वो नहीं पढ़ा. All right, so remember, it's very, very important to have control over your mind. Now, okay, so 1 week is left for NEET. Today is Saturday, you're listening to this session, and 18th is your exam. No need to worry. As I said, you can turn the tables around in this 1 week also, okay, because abhi picture baki hai. You never know, whatever topics you revise in this remaining 1 week, usi se questions aa jaye. You never know that. So what my point is, just train your mind to finish off all your pending work. If you feel some volatile topics are there which you cannot recall during your GTs or CTs or SWTs, whatever, open your notes and just finish it off, rather than hyperventilating कि ये याद नहीं हो रहा. Remember, every 5 minutes wasted in worrying and becoming anxious and thinking about the result is going to take you away from your dream. On the other hand, every 5 minutes utilized in reading at least at least 5 lines is going to bring you or push you closer to your dreams. And पैसा इंसान जितना मर्जी कमा ले दुनिया में, लाइफ में, लेकिन टाइम कभी दोबारा से नहीं आ सकता जो एक बार चला जाता है. तो आपके लिए टाइम बहुत बहुत इंपॉर्टेंट है. टाइम आपको वेस्ट नहीं करना है. नाउ जो भी हुआ, वट एवर हैपेंड इन द पास्ट, उसको भूल जाओ. पास्ट इज पास्ट. डू नॉट फील गिल्टी अबाउट एनीथिंग. योर बेस्ट डे इज टुडे. जैसे मैंने कहा, आई थिंक मेनी स्टूडेंट्स माइट बी थिंकिंग कि अभी 1 हफ्ते में हम क्या ही कर लेंगे. ठीक है, अब जो वायरस है जिसने पूरी दुनिया में उत्पात मचा रखा है, दैट इज हर दिन नए नए केसेस आ रहे हैं. तो गाइज, तुम लोगों के पास तो फिर पूरा हफ्ता है. ऑलराइट, जैसे मैंने बोला, रिवाइज योर वॉलेटाइल टॉपिक्स, डू दोज क्वेश्चंस thoroughly again, whose answers which you could not attempt or you attempted wrongly in the tests. Okay, make a list and अभी से लग जाओ. Then my GT score is so low and I'm left with so many topics. अब ये सारी चीजें जो होती है ना, ये आपके मतलब कंट्रोल में है. अगर GT स्कोर लो भी है तो आपको बेसिकली वो एक ब्लेसिंग इन डिस्गाइज की तरह लेना है कि अच्छा, ओके, सो एंड सो टॉपिक्स आई was not thorough with, so let me revise them, let me open my notes, or if I have any doubt, let me consult the faculty and let me clarify my doubts. And even if you're left with so many topics, guys, बस लग जाओ, because जैसे मैंने बोला कि आपके लिए टाइम बहुत इंपॉर्टेंट चीज है, टाइम आपको वेस्ट नहीं करना है. दीज थिंग्स आर इन योर कंट्रोल. वेदर द एग्जाम इज गोइंग टू बी पोस्टपोन्ड और पैंडेमिक है, क्या होगा, दीज आर ऑल एक्सटर्नल फैक्टर्स, दे आर नॉट इन योर कंट्रोल. सो ट्राई टू कंट्रोल ओनली दोज थिंग्स जो आप कंट्रोल कर सकते हो. And learn to enjoy the process. Okay, you all of you are blessed. You are doctors and everybody is not blessed enough to prefix doctor to their name. ये हमेशा याद रखना. You are the cream of society. तो already आप achievers हो and भगवान इससे भी आगे लेके जाएगा. Just enjoy the process of learning. Do not think about the result. The more you focus on the process of learning, the more you train your mind to finish off all the pending work which you need to do, automatically वो result में भी reflect होगा. Alright? अब every mistake in every test is an opportunity to improve, as I said, provided you learn from it. Rather than शोक मनाना कि ये गलत हो गया, इतने क्वेश्चन गलत हो गए, स्कोर लो हो गया, उससे कोई फायदा नहीं होगा. आपका कर्तव्य ये बनता है कि जो भी टॉपिक्स गलत हुए हैं, जो भी क्वेश्चंस गलत हुए हैं, उनको बस आप रिवाइज करो. यू नेवर नो, इमेजिन करो अगर सेम टॉपिक अभी अपकमिंग एग्जाम में आ जाए, देन यू विल फील गिल्टी और बहुत रिग्रेट करोगे कि यार उस टाइम मैंने पढ़ लिया होता. ठीक है, लेकिन तब कुछ हो नहीं पाएगा. तो बेसिकली एज आई सेड, ये जो मिस्टेक्स हो रही है ना, अभी जितनी मिस्टेक्स करनी है कर लो, उस दिन मत करना. देन पॉजिटिव सेल्फ टॉक. हम अपने सबसे बड़े वेलविशर हैं, सबसे बड़े क्रिटिक हैं, हम ही हैं जो सबसे ज्यादा अपने आप को पैम्पर भी करते हैं. पॉजिटिव सेल्फ टॉक बहुत इंपॉर्टेंट है. अपने आप से बात करो. आई एम श्योर अभी बहुत सारे मोटिवेशन सबको चाहिए होती है, मुझे भी चाहिए होती है, राइट. लेकिन गाइस एक पॉइंट ऑफ टाइम ऐसा आता है सबकी लाइफ में जब लगता है कि किसी से बात करके कुछ नहीं होगा, तब आपको अपने आप से बात करनी है. ओके, सो टेल योर सेल्फ, आई एम अ डॉक्टर, आई एम ब्लेस्ड, आई हैव कम सो फार, और मैं इससे आगे भी जाऊंगा या आगे भी जाऊंगी, एंड मुझे बस अपने पेंडिंग टॉपिक्स खत्म करने हैं, प्रोसेस पे फोकस करना है, अपना बेस्ट देना है. इवन दो दिस इज अ वेरी इंपॉर्टेंट मैसेज फॉर दोज पीपल हु प्रोबेबली आर, उनके हिसाब से दे आर नॉट वेल प्रिपेयर्ड एंड अभी 7 days में हम क्या ही कर लेंगे. बेटा 7 days में भी बहुत कुछ हो सकता है, तुम बस करना चालू करो. ऑलराइट, डिसबिलीफ इज अ सिन. नाउमीदी एक गुनाह है. तो पहला तो माइंड ब्लॉक अपने माइंड से ये निकाल दो कि अभी क्या हो जाएगा, मैं क्या कर लूंगा, क्या कर लूंगी. सब कुछ कर सकते हो, पूरा पोटेंशियल है, एंड आपके पास आपके नोट्स हैं, आपको पता है आपने कहाँ गलतियां की हैं, बस उनको सुधारना है. सो बेसिकली हर स्लाइड से मेरा एम्फसाइज करने का मतलब एक ही है. ऑलराइट, और जो टॉपर्स होते हैं ना, वो भी कोई जुपिटर सैटर्न से नहीं आते. दे आर नॉट एलियंस, दे आर लाइक यू, एंड हु नोज, हम आपका भी इंटरव्यू देखेंगे, राइट. तो अपने आप को ये बोलो कि जब टॉपर कर सकता है तो मैं भी कर सकता हूँ. मैं खुद एक टॉपर, एक पोटेंशियल टॉपर हूँ. ऑलराइट, तो यहाँ पे एक चीज मैं और बोलना चाहूंगी कि व्हाइल यू आर अटेम्प्टिंग द पेपर ऑल्सो, सपोज यू आर स्टक इन अ पर्टिकुलर क्वेश्चन, ठीक है, तो तब घबराना नहीं है. रिमेंबर, सिंपैथेटिक एक्टिविटी डिक्रीजेस कॉर्टिकल एक्टिविटी. इफ यू वांट टू परफॉर्म वेल इन द एग्जाम में भी अपने माइंड को मास्टर करना है. अपने आप को तुम्हें ये बोलना है, सेल्फ टॉक करनी है कि कोई बात नहीं, ये क्वेश्चन अगर मुझे नहीं भी आता तो क्या हुआ, टॉपर को भी कौन से सारे क्वेश्चन आते हैं, शायद मैं टॉपर हूं. ऑलराइट, टॉपर की भी कितनी परसेंटेज, 60-65, इतनी 60-65% ही आते हैं, तो इसका मतलब बाकी 30-35% तो टॉपर को भी नहीं आता होगा. 100% पेपर सिर्फ एग्जामिनर को आता है. ऑलराइट, तो पेपर करते समय आपको घबराना नहीं है. इफ यू आर स्टक इन अ क्वेश्चन, उस टाइम नहीं आता, कोई बात नहीं, उसको छोड़ो, नेक्स्ट क्वेश्चन पे जाओ. ऑलराइट, और पहले वाले क्वेश्चन से डिटैच हो जाओ, देन फोकस ऑन द नेक्स्ट क्वेश्चन. ओके, दिस इज वेरी वेरी इंपॉर्टेंट, बिकॉज एग्जाम में अगर तुम घबरा गए तो जो आता भी होगा, जो याद आना चाहिए था, वो भी याद नहीं आएगा. ऑलराइट, सो ये बहुत इंपॉर्टेंट है. एंड जैसे मैंने बताया कि अभी 7 दिन बचे हैं, तो 7 दिन भी बहुत होते हैं. नाउ इज द टाइम, एंड द टाइम इज ऑलवेज राइट टू डू व्हाट इज राइट. सही काम करने का कोई गलत टाइम नहीं होता है. ठीक है, तो सारी गिल्ट जो भी हुआ, अगर नहीं भी पढ़ा, टाइम वेस्ट भी कर दिया, उसको मत सोचो, क्योंकि उसका वैसे भी कुछ नहीं हो सकता. तुम्हारे पास आज है तुम्हारा, अगर आज मेहनत करोगे तो आने वाले टाइम में उसके रिजल्ट्स भी मिलेंगे. ऑलराइट, नाउ यहाँ पे अच्छा एक और चीज मैं बोलना चाहूंगी. यहाँ पे हमारे आसपास बहुत सारे लोग होते हैं जो एक्चुअली में हमारे मतलब वेल विशर्स होते हैं, सपोर्टर्स होते हैं. ऑफ कोर्स आवर फैमिली एंड फ्रेंड्स हु आर लाइक फैमिली टू अस, दे वांट टू सी अस फ्लरिश इन लाइफ एंड डू वेल. बट अगेन देर आर ऑल्सो सम पीपल हु विल कीप नैगिंग यू कि अगर इस बार नीट नहीं निकाला या इस बार सीट नहीं मिली तो तेरा क्या होगा. ओके, आई वुड humbly request all of you to stay away from such people. They are not good for your mental health. इनको या तो block कर दो या unfriend कर दो या जो मर्जी करो. Just stay away. And
कौन है ये लोग? कहां से आते हैं?
nobody has got the right to tell you कि आप क्या कर सकते हो और क्या नहीं कर सकते हो. ओके तो ये बहुत इंपॉर्टेंट है कि आप अपने माइंड में किसकी बात को फीड कर रहे हो, किसको इंपॉर्टेंस देते हो या नहीं देते हो. इंटरैक्ट विद ओनली दोज पीपल हु वांट टू सी यू वेल, हु वांट टू सी who want to see you do well in life, who want to see you successful and attain prosperity. ठीक है. आई थिंक आज की पूरी प्रेजेंटेशन में जो ये मेरे हिसाब से तो सबसे इंपॉर्टेंट स्लाइड है, इवन मोर इम्पॉर्टेंट देन एकेडमिक्स. ओके लोग आपके बारे में क्या सोचते हैं, अगर ये भी आप ही सोचोगे तो फिर लोग क्या सोचेंगे. इट्स वेरी वेरी इंपॉर्टेंट टू रिमेंबर कि हम अपने आप को कैसे देखते हैं. ठीक है, जैसे मैंने एम्फसाइज किया अभी कि आपको किसी की बात नहीं सुननी है, आपको बस अपने काम पे फोकस करना है एंड किसी से पूछना भी नहीं है कि अपने फ्रेंड से कि तेरा कितना हो गया, तेरा कितना हो गया. बिकॉज एग्जाम के उन 3-3.5 घंटों में आप अकेले हो. उस टाइम पे आपकी मेहनत काम आएगी और आपके वेल विशर्स की, आपके पेरेंट्स की वेल विश, आपकी उनकी ब्लेसिंग्स काम आने वाली हैं. ऑलराइट, तो ये जो एक्सटर्नल इन्फ्लुएंसेस हैं, एक्सटर्नल लोग हैं या चीज़ें हैं, इवेंट्स हैं, इनसे अपने आप को दूर रखो एंड जस्ट focus on learning, on the process. Okay, on the process of learning. Trust you me, if you train your mind to do all this, आपके लिए success is going to be just a cakewalk. Okay, you yourself will be surprised with your result. All right. So guys, on this note, I shall take your leave and all the very best to all of you for all the upcoming exams. Do get in touch with me if you need any help. Okay, regarding the subject or even non-academic help also. Okay, always there for you. We'll be very happy to help. Okay, so with this I'll say bye and hope to interact with all of you in yet another session. Thank you.